Okay, so just for those who came late, welcome to the Family Quality of Life breakout session. In this breakout session, if you have any questions for Vanessa, feel free to privately message the session C questions, Angel, so that we can pose those questions to Vanessa when we have the question period at the end. And if you could keep your cameras and microphones off, that'd be great because we'll be recording this. So we want to make sure that we have clear audio and are able to hear everything that she has to share. So I will just do a quick introduction for Vanessa. So she is a doctoral student in the developmental psychology program at Simon Fraser University, and she is involved in research that adopts the community engaged approach to understanding quality of life in families raising autistic children, especially those who are culturally diverse. So in her study, she has become deeply committed to community engagement and knowledge translation in the field of neurodevelopmental disabilities. So she hopes that collaboration and building relationships with community members will bridge the gap between research and practice, therefore prioritizing research that is meaningful and relevant to those who are impacted. So join me in welcoming her, and we look forward to your presentation.
Thank you so much. So I'll just share my screen. Hopefully you can see it clearly. Yeah, okay. So, hi everyone. Thank you for the introduction. My name is Vanessa Fong. Like Christy said, I'm a PhD student at Simon Fraser University. And today I'll be talking about a study that we did back in July that asked parents to report on their quality of life and other outcomes during the lockdown period that began in March. So why focus on the family? So in many cases, developmental disability is often unexpected. There are differences in development, but also parents may not have previous experience parenting a child with a developmental disability. And this can potentially lead to elevated stress in families. So children with developmental disabilities are also more dependent on the family for a longer period of time, and they rely on comprehensive support the lifespan. So it's important to look at family functioning and family quality of life as a system, because the individual with a developmental disability, as with neurotypical children, do not exist in isolation. So the impact of their development is felt on the entire family unit. So when we look at autism specifically, we might predict that families and their autistic children may be impacted differently compared to other developmental disabilities. So for example, because social skills are one of the core challenges, autistic individuals often face social isolation, which can extend to other family members. So some parents have reported difficulties kind of maintaining friendships and building connections with other community members. And because autism has a high genetic basis, there's also an increased likelihood that other family members are impacted in some way. And there's growing research suggesting that the severity of symptoms does not necessarily reflect the individual's level of need. So this emphasizes the importance of taking an individualized approach to assessing needs and supports. And while research has focused a lot on the individual's service and support needs, less research has focused on how to support the entire family. So now I'll briefly discuss the context of the current study. So we decided to do this study because we recognized that families were really struggling during the pandemic. We were hearing a lot of stories from families and parents and autistic individuals, and it became clear that service gaps that existed prior to the pandemic were magnified and really made worse in light of COVID-19. And this most likely had something to do with school closures, parental employment changes, social isolation, and an overall lack of just essential services. So we had 3 research questions that we were interested in for the current study. So the first was, what is the impact of COVID-19 on the individual, the child, the parent, and the family? The second was we wanted to compare family quality of life before and during the pandemic. And our last question was we wanted to see if there was a relationship between caregiver mental health and family quality of life. Now I'll just talk about our research methods. So we used a community engaged approach to address our main research questions. So what is community engaged research? There are a lot of different definitions, but one of the most widely used ones defines it as when partners contribute expertise and share decision-making and ownership to increase knowledge and understanding of a phenomenon and integrate that knowledge with interventions, policy advocacy, and social change to improve quality of life for communities and reduce health inequities. So in other words, community engaged research involves collaborating with members that belong to the community that you're studying and actually carrying out the research. So these individuals are involved in the design, the implementation, the analysis, and the recruitment. So they're no longer participants, they're now equal partners or co-researchers. So why do this type of research? So there are so many benefits to both the community and researchers like myself. So a benefit to the community is that they're able to generate knowledge that their community cares about and that research that they need. They're also actively involved in determining the research questions. They get to have a say in decision making and in setting the research priorities. There are also benefits to researchers as well. So by working with communities right at the beginning of the study, this helps increase the likelihood that the research that you're doing is relevant and that it will have a positive impact. And because the knowledge that is generated is more likely to be relevant because we've collaborated, this can help facilitate and expedite the knowledge translation phases of the study, which we'll talk about at the very end. So for this project, we partnered with Deborah Pugh, from the Executive Director of ACT, or the Autism Community Training. It's a nonprofit organization. So Deborah Pugh was highly engaged and helped identify research priorities in our community. She helped with formulating our research questions and our objectives. And she also helped co-create our COVID-19 survey, along with other parents and autistic individuals in the community who provided their feedback. We also consulted with researchers in other universities, a group at the National Autism Research Center of Israel, and another lab at SFU called the SAGE Group. So Deborah's feedback on our various study documents, including the recruitment flyer, the advertisements, really helped increase the number of participants that were recruited. And lastly, Deborah was involved in the knowledge translation phases of our study, so moving our research findings to the general public, to parents, to autistic individuals, and the community. So our study sample. So all of our respondents were caregivers. They were residents of BC. And we have 2 samples that we used. So we have this before COVID-19 sample. This sample was different than the during COVID-19 sample. So they're two distinct groups. So for the COVID-19 sample, in the second column here, this during group, this sample was recruited. This sample comprised of 238 caregivers of autistic children between the ages of 1 to 20 years old. And for both samples, the majority of respondents were mothers. You'll see that there's an asterisk beside each of these different demographic items. So this indicates that we were only able to collect this specific data for 126 out of the 238 caregivers here. So just keep that in mind. So we began collecting data in July through September, asking parents to report on outcomes that occurred during the initial lockdown period, which began in March. And we assessed child and caregiver outcomes related to sleep, behavioral problems, mental health symptoms. We also assessed family quality of life using the Beach Family Quality of Life Scale. So this was our main outcome measure. So we'll just talk a little bit more about this. So this is an important outcome measure because it evaluates how families are doing globally and they're functioning across a range of different areas, a range of different domains. So we have 5 domains for this specific scale. And there are 25 items in total that measure satisfaction across these 5 domains. So for the family interaction domain, this area assesses perceptions of relationships between family members. Do they enjoy spending time with each other? Things like that. The parenting domain assesses satisfaction with activities that the families or that the parents engage in to help facilitate their child's development. The emotional well-being domain assesses perceptions of stress and support availability, informal supports within and outside of their family. The physical material well-being domain measures satisfaction with their physical needs. So things like, do they have access to medical support, transportation, and things like that. And the last domain is the disability related support domain. And this includes satisfaction with supports that are in their community and other contexts. Do they have supports that they need in school, at work, at home? So this scale includes 25 items, again, over 5 domains, and they have to, caregivers will rate statements from either very dissatisfied to very satisfied. And these are some examples of the items from this scale. So parents rate their satisfaction with all of these statements. These are just the first 5. So for example, the first one is, my family enjoys spending time together. This specific item would map onto the family interaction domain. Okay, so now I'm going to talk about some of our main findings. So our first research question is, we wanted to look at generally what is the impact of COVID-19 on the child, the parent, and the family. So this diagram here illustrates the impact of COVID-19 specifically on the child. So the colors, the colors indicate, the orange colors here, they indicate a greater negative impact. So if you look at the legend here, these orange, yellow, orange items indicates a degree of disruption, whereas the blue colors here on the left indicate more positive impacts. So you could see in this diagram that the majority of responses are concentrated on the right-hand side. So this orange side here, indicating that the majority of caregivers are reporting a moderate to extreme disruption in each of these domains. So behavioral problems, we had 33 caregivers say that this area was slightly disrupted with COVID, and whereas 25 caregivers said that this area has been extremely disrupted. So you can see that the majority of responses, again, they're concentrated on the right-hand side. And only a minority of caregivers report improvements in each of these areas. So now this figure here is illustrating the impact of COVID-19 on the caregiver, on the parent. So looking at anxiety, family relationships, relationships with their spouse, and sleep quality, again, we can see a similar pattern where the majority of responses here are indicated, are concentrated on the right side. So I forgot to say this, but this gray area is kind of the middle, the center. So there are larger orange slices or orange red slices on this side compared to the blue here, indicating that the majority of parents are reporting a moderate to extreme disruption on each of these different areas. We also asked caregivers specific questions. So whether or not during the lockdown period, did they ever consider putting their child into care, giving their child up to the ministry due to a lack of services and support? So we found that almost 10% said yes, which was really shocking. We were also interested in safety issues in these households. So when asked whether or not caregivers were worried that their child would physically hurt or harm another family member, approximately 37% of caregivers said yes. So moving on to our second question, we were interested in looking at how family quality of life differs before and during the COVID-19 lockdown. So keep in mind that the before COVID-19 sample, so this white bar here and this black bar here, this gray bar, they're different samples. They're not the same. We didn't match the samples. So when looking at overall family quality of life, so taking the 25 items and scoring them and getting their averages, we found that there's a significant decline in satisfaction in our COVID-19 sample compared with a sample that was assessed pre-COVID-19. So these bars maybe don't really, aren't the best at illustrating this significant difference, but this was found to be significant. And it's important to note that even before the pandemic, families of autistic children are already scoring much lower than families of typically developing children. So I should put it here, but if we were to graph typically developing families or children and their families, they would be around a 4.5 for overall family quality of life. And this impact on quality of life was emphasized by one caregiver who shared that they experienced a decline in quality of life for all of our family members. I could not keep up with work or parenting, and the only way I could manage to make it through most days was to plug my kids into video games and social media for hours on end. We also looked at the individual domains that comprise this family quality of life scale. So again, there were 5 domains. There was no significant difference in the family interaction domain. However, there was a significant decline in physical well-being during COVID-19 compared to families that were assessed pre-COVID. When looking at the parenting domain, families assessed during COVID-19, so this gray bar here, they report lower satisfaction in this domain compared to before the pandemic. To illustrate this, to illustrate these parenting difficulties, one parent said, "I have worked as an EA in the past and enjoyed it immensely, but the pressures of working full-time from home while simultaneously parenting and teaching were debilitating. If our children completed even one small school task in a day, it was all we could reasonably expect with the resources we had available to us." And this disability related support domain, this was the second lowest domain for families during COVID. So this was expected given that most families were cut off from most, if not all of their supports, especially during the initial period. So one parent was quoted as saying, "My son experienced a substantial escalation in problem behaviors, including physical aggression during this time, but we had considerably less access to supports and services. This negatively impacted our family." The last domain, so families during COVID-19 reported the lowest satisfaction in their emotional well-being. And this domain, again, it assesses perceptions of feeling supported, their capabilities in coping with stress in their lives, their availability of informal supports within and outside of their households. So many families report poor emotional well-being. The mean score for this group was 2.49 out of a possible 5. So one parent commented, "At least 4 times a day we were in an emergency," or sorry, "at least 4 times we were in an emergency mental health crisis situation." Another parent was quoted as saying, "I've been close to relinquishing guardianship to just keep what's left of our family together." So these quotes and this data really highlights the stress and desperation of most families. And our last research question examined the relationship between caregiver mental health and family quality of life. So this graph on the left, you could see a positive correlation between overall family quality of life and caregiver mood. Greater satisfaction with quality of life, so these higher scores here, um, was associated with improved caregiver mood. So higher scores on this mood scale indicates better mood. We also did a multiple regression to see if parent mood was a significant predictor of family quality of life. And we found that after controlling for demographic factors, so age and gender, this parent mood was found to be a significant predictor of overall family quality of life. And in addition to general mood, we also looked at caregiver anxiety. So we found that greater satisfaction with family quality of life was associated with less anxiety symptoms. So here now, higher scores indicate elevated levels of anxiety. So you can see that higher scores indicate higher scores on family quality of life indicate less anxiety symptoms. And we again did a multiple regression, and we found that caregiver anxiety or parent anxiety was a significant predictor of family quality of life, even after controlling for these demographic factors. So these findings suggest that mental health is an important factor when considering overall family quality of life and their overall functioning as a family. And some of our, so just to summarize our main findings, parents report elevated child behavioral problems, anxiety symptoms, sensory difficulties, sleep problems, and difficulties coping with their daily routines as a result of the pandemic. Parents report greater anxiety symptoms, sleep difficulties, and also spousal discord during this pandemic. And families report significantly lower family quality of life compared to before the pandemic. And lastly, caregiver mental health is significantly associated with family quality of life outcomes. So now I'll just talk about where we're currently at, which is in this stage of knowledge translation. So in terms of what our knowledge products or research outputs look like from this project, so far we've presented at some conferences with our partner, sometimes without them. Some of our findings, we've presented these findings at various conferences. We've also put together a report summarizing our results for policymakers and ministry representatives. So making recommendations to the government based on our data. We were also really fortunate to get some media attention over the last few months, kind of covering our study, which helped raise public awareness of this really pressing issue, which is that families of autistic children are not receiving the sufficient supports that they need. And recently we put together an SFU panel where we had ministry representatives. We had the representative for children and youth attend. We also had a parent and the chair of BC Ed Access and the executive director of Inclusion BC also present. So this panel really opened up a conversation on potential solutions, given what we know now, not just about families of autistic children, but with the broader community, the broader special needs community, and raising these issues and trying to generate potential solutions. So I'm reaching the end of this presentation, but I just have provided some of our information here, our website for our lab at the ADDL at SFU, and my own email if you have any questions or feedback. And sorry, lastly, I should also mention, I would like to say thank you and acknowledge all of the families that participated in our study, as well as our partner organizations and collaborators. And I would also like to thank the Kids Brain Health Network and MyTax for the funding and support to conduct this study. Yeah, so that's kind of the end of my presentation. If anyone has any questions or feedback, you can be very honest. Please let me know.